So I'm going to give you an overview of Introduction to Drugs, Health, and Society. And each week I'm going to do a video lecture, and they're going to be about 25 to 30 minutes long. And I highly recommend that you listen to the video lectures because it really gives you an idea of we're going to be covering on the exams, on the midterms, and it will also help you do the chapter reviews. So here we go. Let's get started. So the goals of this class, by the end, I want to make sure that you identify the differences between drug use, misuse, and abuse. You will know those three things. We're going to talk about drug laws. We're going to talk about how drugs impact both your physical, neurological, how it impacts your brain. And we're going to talk about the classifications like Schedule 1, Schedule 2, Schedule 3, Schedule 4, and Schedule 5 for drugs. We're going to have to be talking about the prevalence and incidence and how drugs are impacting Kern County. And then I'm going to have you do a gap analysis on drugs in our county. So we're going to be going over, these are going to be the focus of the whole entire class, the whole course. So I want to make sure that you have the big overview here. When I talk about drugs and drug abuse, you need to know that it is impacting our society. And this is a picture of all the drug overdoses and how it's been rippling across the United States for opiates. So this is for narcotics. And you could see that, where's Kern County? We're right in here, and look, we're red. And so you could see that it's impacting in California, where it's impacting. And interesting, look at the north. The north, in the northern areas, and then Kern County. So you can also see how it's impacting across the United States. When I talk about drugs also, I think it's important to understand that a society can be impacted also by how drugs are passing through its community. And so with methamphetamine, or meth, Kern County is situated in a major transportation route for the illegal drug of meth. And so you can see Kern County is right here situated right here by 5 and 99. And you can see all the meth that's being pushed through our county and going out through the United States. So these are the major transportation corridors for meth. And this impacts our community. And for example, when we talk about meth, 1 out of every 3 emergency room visits are meth related. It impacts us greatly in Kern County. So what really constitutes a drug? How common are drugs abuse? These are some of the questions that you guys have posted on the discussion post already. Here's some other questions. When does drug use lead to drug dependence? These are all the different things that we're going to be covering in this class. So drug use causes 3 big changes in the user. 3 big ones. They are resulting a high, that immediate high. It impacts the body chemistry. And then using a particular drug may satisfy an inborn or genetically programmed need. So, and sometimes people are predisposed to be addicted to a drug because of genetics. They have low levels of a certain neurotransmitter, or they genetically process a chemical differently than someone else. So you need to understand that those are 3 things that happen with a user. Remember in the very beginning I talked about drug use, abuse, drug misuse, and drug abuse. So drug use is basically using it across all professions, and no one is immune to drug use. And at one point, there will always be a time when someone uses a drug and not necessarily get addicted, but might just use it. Okay, so that's drug use. And there are 4 big principal factors that affect drug use. They're biological and genetic and pharmaceutical factors. So it's like how someone's predisposed to it. There's cultural factors, and this is shifting more for like how drug use can move to something where it becomes abuse. Social factors and contextual factors. I'm going to go over each one. Biological, genetic, and pharmaceutical factors are really involved in how it affects the body biologically. So So how it affects the nervous system, how it really affects you chemically. So think of it that way: biology, your genetics, the pharmaceutical, the chemical side of it. So everyone is impacted differently by drugs and how it affects your body. So, even someone will take one ibuprofen and get affected one way, while someone else takes an ibuprofen and they're like, yeah, I don't really feel any difference. And so they have to take more of the drug, or maybe they feel like they need to take an aspirin. So everyone has a different reaction to drugs. There are cultural factors. So like how society views it. So if it's custom to have alcohol at the dinner table, or it's a part of a tradition, that's something that will affect drug use. There are social factors. Why is the drug being taken? Is it being used to self-medicate, to try to escape from reality, from peer pressure? And there are contextual factors. What's surrounding some people as they use the drug? Like, for example, music concerts have some exposure to certain types of drugs more than others. Bars, nightclubs, fraternities, sorority parties. All of these affect how a drug is used. Now, there are different drugs and they impact us differently. And I want to say that tobacco, looking at this chart here, is the number one cause of death and they can correlate it. This is followed also by alcohol and then illicit drugs. So tobacco is still really high. There are dimensions of drug abuse. So what is considered a drug? It's anything that modifies your mind or body. What is a psychoactive drug? Psychoactive means mental and active. So it's anything that affects your central nervous system or alters your consciousness or perception. And psychoactive will be something you will hear about constantly. Psychoactive drugs include legal drugs like caffeine and tea. Those are all considered psychoactive drugs because it impacts you. And tea with caffeine, obviously, and coffee with caffeine in it. So psychoactive drugs are classified in two ways. First is illicit. Are they legal? These are examples of legal drugs: coffee, tea, alcohol, tobacco, and over-the-counter drugs. And then they're illicit. They're legal drugs. These include marijuana, cocaine, and LSD. And marijuana falls into being illegal because it is illegal at the federal level. And so that makes it illegal at the workplace. Next, just me. Hey, next is you need to look for the challenge here. And I want you to go ahead and think about the different types of drugs that are out there. So I'm looking for 12 types. Alcohol, and ethanol is the one that's addictive. Nicotine, all forms of tobacco. Prescription drugs, okay, so that's like 3. Let's see if you can name some more. Stimulants on your list. Hallucinogenics. Okay, I'm going to go to the next page. What else have I not put there? Bath salts. Was that already in your mind? Yeah, people inhale bath salts. Depressants, all of them. We'll be going over all these different drugs. Cannabis, marijuana, hashish. Steroids. Inhalants like gasoline and glue and paint thinner. And then finally, narcotics and opiates: opium, marijuana, codeine, and heroin. There's something called designer drugs, and designer drugs are drugs that have been changed to try escape being considered illegal, but they're still considered illegal. I know that's a circular statement I just made, but they change it to alter the chemical structure to try to make the drug legal. So designer drugs are, you might have heard of these things called synthetic opioids. And yes, they can lead to deaths. And synthetic drugs and designer drugs like ecstasy. And these are things where people are trying to escape the drug laws by making them synthetic. The thing called gateway drugs. And I think you guys know what gateway drugs are. I've heard of this term before, I'm hoping. And here we go, ready? Gateway drugs are anything that opens up the door to further drug abuse. And can you name 3 gateway drugs? Alcohol, tobacco, and marijuana are considered gateway drugs. Then there's something called drug misuse. And this is when someone uses it unintentionally or inappropriate use of prescribed or over-the-counter drugs. This is 6 reasons, or more like 6 examples of drug misuse. Taking more drugs than prescribed. Using OTC or psychoactive drugs in excess. Mixing drugs with alcohol. Using old medicines to self-treat new symptoms. So someone gets prescribed Percocet for a root canal and then decides to take it for back pain. That's drug misuse. Discontinuing using a prescribed drug at will or against the physician's order, so they decide not to take it anymore. And giving a prescription drug to a family member who does not have that prescription for that drug. So I want to stress this. If someone is using a drug and they don't have a prescription, and let's say they're in the medical profession, they will lose their license or get fired because they need to always have a prescription, because drug misuse leads to abuse. And it's a very serious thing. So I want to stress that. And then there's dimensions of drug abuse. And so, and this is where we start to move from drug misuse to abuse. And this is where it starts to become compulsive. And it's used for beyond the purpose of recreation. And so you need to understand, well, it could be used for recreation also, but then turn into compulsive needs. So these are some of the statistics and trends. So you can see the impact of social drugs and prescription drugs, over-the-counter drugs, miscellaneous drugs. So here's a drug quiz for you. How many Americans aged 12 and up use alcohol? How many Americans in the past month have used smoked tobacco? Look how many have used marijuana, hashish in their lifetime. How many drugs can be found in the average household? In the minimum 5 drugs. Look at this. So, could you answer these questions? What percentage have used alcohol in their lifetime? Could you guess? How about cigarettes? How about illicit drugs? Just take a rough guess. There are your answers. So if you thought, oh, about 82%, you were close. 80%, 60%, and then almost half Americans have used illicit drugs. So if you look at the most commonly listed drugs, we've got everything. And if you thought in your discussion you put marijuana as the big one, that is the one that's at the top here. And then, but you could see that cocaine, hallucinogenics, and pain relievers are up there also. Oh, and look at, in close second, we have also, not that close, but pretty close, we have pain relievers. And so people are constantly using drugs to treat pain themselves. These are the groups. And so which age group has the highest use of drug abuse? It's age 18 to 25. So you need to know that drug misuse and abuse is really happening within the 18 to 25 age range with illegal drug use. And these are the racial and ethnic differences there. So drug use is really high in this age group. And this puts them at risk for drug abuse. So drug use can lead into drug abuse. So here's some other findings. Males are more likely than females to be using age 12 or older to be using illegal drugs. And the rate of past month marijuana use was about twice as high for males as that for females. And pregnant women are less likely to use drugs than women who are not pregnant, which is a very good thing because women, when they're pregnant, they expose the fetus with the drugs that can actually do birth defects and it could harm the fetus. So it's important for anyone who's pregnant not to be near or close to any type of drug. So college students have the lowest rate of drug use, and employment also has can have an impact on drug use. Criminal justice system, over 1/3 of state prisoners and then federal prisoners have used drugs. 40% of arrestees tested positive for presence of multiple drugs. And then 40% tested positive for marijuana, cocaine at 30%, and 20% for crack. So there are 3 different types of drug users. There's experimenters, and these are the ones that just are curious, and it's confined within a recreational setting. Compulsive users are the ones that have to have the drug and they need it to survive. And the floaters or the chippers are the ones that join in and use the drug, but they're not the ones who are supplying it or seeking it out. So they join in and they're floaters or chippers. So the big thing is that media has influenced drug use. And you see the amount that alcohol industry spends on advertising. What the drug companies do here, you can see the amounts in the millions. And the prescriptions, 5.5 billion in marketing prescription drugs. That's up from 3.5 billion in 2012. Now think about that. People coming into their doctors and saying, I want that drug with the butterfly, or I want this drug that I saw on TV. And this is becoming a problem because a lot of those drugs that are prescription that sometimes they get advertised on TV, can be very highly addictive. And so it's up to the doctor to really start screening that and not fall into that pressure from their patients. And then teens that view social media are 4 times more likely to use marijuana and 3 times more likely to use alcohol and tobacco if they see friends on their social media using alcohol. So social media can actually influence that usage, that use. So people use drugs to escape, to relieve stress. They might be a part of religious experience or a mystical experience, or to relieve pain. So these are some of the things that we're going to be talking about in this class. And when someone says what leads to abuse, it's the amount that someone's taking and it's the motive for taking it. So if someone is taking an excessive amount of a certain drug, that is considered abuse. And if they're taking it to function, to get through the day, that is also a sign. There are 2 different things I want to stress on. There's physical dependence, and we're going to talk about each drug as we go through each week and talk about the physical dependence on a drug. Some people are more apt to this physical dependence, but there are also some drugs that actually create more physical dependence. So for example, alcohol and meth have high physical dependencies compared to LSD, which has a low physical dependence. Psychological dependence is something that where someone mentally starts to get, mentally needs it in order to not physically, but mentally needs it in order to function and focus. So they need to have certain aspects of it to just function. So for example, caffeine. Sometimes you'll hear people saying they need their caffeine to focus. So people can be addicted to a drug both physically and psychologically. And obviously, if they're addicted both ways, both physically and psychologically, it makes it more difficult for them to stop. So the higher the physical dependence and the higher the psychological dependence, the harder it is for someone to stop using a drug. So if someone is not physically addicted to a drug, they might find it's easier to stop using a drug. So there are stages of drug dependence, and it's like a cycle. They go through relief, increased use, preoccupation, dependency, withdrawal, and boom, they take the drug again, and they get that relief. And it goes over. It's a cycle. There's a lot of cost to society. Illnesses, shortness in lifespans, obviously impact. And we're going to be talking about all these different things as we go through this course. I want to tell you that the habit also costs a lot as far as money. So it costs $150 a day for a narcotic habit. Get this, a heroin habit costs $160,000 per year. And this last bullet, 3 out of 4 prostitutes in major cities have serious drug dependency. And this actually leads to why people sometimes stay in prostitution, a big reason. And that's where we start to get human trafficking and sexual abuse, is because people are staying in it because they are addicted to a drug, and it's a vicious cycle of drug and prostitution. It also affects violence. And so I could go through all of these statistics, but you can actually trace drugs and alcohol to domestic violence. Domestic violence often has those happening, and it increases those chances. In the workplace, it's rampant in the workplace. And you often talk to employers, and they struggle with this because what do you do if someone's addicted to alcohol and drug use? And so all workplaces have, not all of them, but there are many workplaces that have mental health services and ways to get their employees off. But at the same time, it's one of those hidden problems that people do not always talk about. And so these are some of the statistics. So the entertainment industry compared to construction, but look at this, the lowest rates are among mining, educational services, and public administration. So where someone works can actually influence their drug use too, and how much they're exposed to it. This is really interesting, drug testing. People often ask, how long does a drug stay in a urinalysis? How long does it stay in different things? And hair analysis, it stays up to 1 to 3 months. So you can see how companies use drug testing. So the bigger the company, the more likely they're going to use it. It also depends on what type of industry it is. So like in construction, that's something that's part of it. In the medical community, that's part of it. And so you'll see that it depends on what labor force it is and how they're using it. Again, this is how often it stays in the bloodstream or in the urine. It really depends on how much someone's using it and where it's at. So for example, with alcohol, I find this interesting. People think sometimes they can sober up with caffeine. No. Alcohol stays in the system, and the more someone drinks, the more time it takes to get out of the system. So people can't just sober up. If they're drunk, it takes hours for it to get out of their system. And then finally, we're going to talk about ways to get off of drugs. And that's something we're going to be always talking about with each drug, is how it's treated and what are the different things. So with this class, I want to make sure that you, each week that you listen to these video recordings, and you get an idea of how this is. And you can also download these PowerPoints here. And the discussions that we have each week, I'm going to be posting discussions based on these lectures. So it's a really good idea to listen to the lectures before you do the discussion post each week. So this was the first lecture. And I would like to get some feedback on the pacing and if you were able to follow it, and if it worked for you. And if you have any questions, I would really like to have those questions posted in the discussion post. So here we go, first week. Let me know how it goes. And if you have any questions, this is a big overview of some of the things we're going to be covering in this class and some of the things we're going to be diving into. So I'm looking forward to the semester ahead. All right, have a great week.